The rising price of prescription medicine, one of healthcare's biggest points of contention. It was a major topic of discussion among some of the industry's most influential CEOs. Meg Tirrell spoke with them at the Heartland Summit, an annual gathering in Minneapolis.
Since even before he took office, Donald Trump has been putting pressure on the drug industry.
Our drug industry has been disastrous. They're leaving left and right. They supply our drugs, but they don't make them here. They're getting away with murder.
Today, reports the president may be getting close to action.
One thing that we hear is on the table for an executive order is a directive by the Trump administration to move towards value-based contracting for pharmaceutical purchasing. I think that is a good, positive, constructive outcome for the industry and for patients.
The news came as healthcare executives and investors met in Minneapolis for the Piper Jaffray Heartland Summit, where discussions ranged from drug pricing.
One issue we're talking a lot about is the difference between list prices of medications, which get widely reported, and what actually net prices are, and how consumers, individual consumers in high deductible plans in particular, are paying the list price, and why should they be paying that?
To health reform.
It's possible without the right kinds of changes with respect to funding levels and other regulations associated with the Affordable Care Act that we may have to exit certain markets because those markets are not sustainable.
Trump's plans for a potential executive order aren't yet clear, but Allergan CEO Brent Saunders says they could be a positive for the drug industry by focusing not on pricing, but transparency within the system.
We pay those rebates to lower the cost of drugs. That's why the industry pays them. And so having them more directly lower the cost of drugs, I think, is a good thing, and ultimately will lead to a more clear and transparent system.
Such an executive order could be a boon to pharmaceutical stocks, experts said, as an alternative to measures like direct government negotiation over drug pricing.
Still, uncertainty in healthcare abounds. Health insurer Anthem, for example, just made the decision to withdraw from insurance marketplaces in Ohio.
Certain decisions have not been made to further strengthen or stabilize that marketplace. Net, we've come to a sort of a fork in the road in terms of our inability to serve our communities.
Observers hope for more clarity in the coming weeks as Republicans in the Senate hammer out their version of health reform. For Nightly Business Report, I'm Meg Tirrell in Minneapolis.